All right, so welcome everybody. We are the Plan4Health Vista Coalition based in Boise, Idaho. My name is Aaron Mendata. I'm on the coalition and I work with Agnew Beck Consulting. I'll allow my co-presenters to introduce themselves here.
My name is Adam Smith. I also work for the I also work for Agnew Beck.
All right, and so I guess a little bit of an overview of what we wanted to talk about today is because of our unique coalition working with a neighborhood level community, we wanted to talk specifically about working with neighborhoods and working with neighborhood level data as it's related to public health. And that's some of the challenges we've faced as a coalition and also some of the unique alternatives we've had to implement to really thrive at the neighborhood level. So let's just get started here. We'll do a brief overview of the Vista neighborhood.
The Vista neighborhood is a centrally located neighborhood just a few minutes from downtown Boise. It has a population of about 10,000 residents, and one reason why the neighborhood was selected is because it has median incomes lower than the citywide average. It has a higher percentage of children that are on free or reduced lunch programs. And it's also the focus of a couple of other programs targeting the Vista neighborhood, one being the Energizer Neighborhood program, which is being facilitated by the city in conjunction with the neighborhood, that is looking at a broad range of topics from public safety to community services and children and youth programs in the neighborhood. And the other program is a ULI-funded project looking at the Vista corridor as a way of trying to not only beautifying that corridor, but improving access and improving the transit modes on that street so that it is not so much of a barrier within the neighborhood.
All right, so now that we have a little bit of a background about the Vista neighborhood, why it was selected for the Plan4Health Coalition, and why we're specifically looking at Vista in terms of food security, food access, and building a healthier food community, when we started this whole process, we really wanted to do a food assessment to see what the current conditions of the neighborhood look like. And we quickly realized that there was going to be some challenges in collecting the data that we felt necessary to make meaningful action strategies and recommendations to improve food access and healthy food consumption within the neighborhood. And so I'll sort of outline some of these challenges of working at the neighborhood level. And if I'm correct in saying that we are the only coalitions working at the neighborhood level, everybody else is working in a larger geographic area. So this presents some unique challenges for us. Partially just because it's so small. We're working with a neighborhood of 10,000 people, and at this level there's just not any public health data collected. So we're sort of forced to look at the public health data that has been collected for the county, and hopefully can make some assessments as to whether or not that's true for this particular community. We kind of lucked out working with the neighborhood level because the Vista neighborhood directly correlates with 2 census tracts. But in many cases, so if this is a model for future use, a lot of neighborhoods don't perfectly line up with the census data, so achieving perfect demographic information is also difficult. It's such a small level. And it's difficult to sort of assess where you should cut the boundaries for the neighborhood. Is it the boundaries of the neighborhood association, or is it the surrounding areas? So looking at that, it's difficult to assess how far out of a scope we should take. And really we don't have a model to follow for this kind of neighborhood food assessment. It's very new in terms of looking at community food. And part of the Vista neighborhood, like Adam was talking about, has been the focus of a number of studies, including the Energizer neighborhood and the ULI corridor study. So we were looking at a neighborhood that was facing some fatigue from surveys, fatigue from participation in data collection methods. So these are some of the challenges we face looking at such a small geographic area. That's kind of been the study focus in Boise.
And I'll just add that looking at that third bullet on identifying neighborhood neighborhood-specific strategies. Many of these issues that we're looking at, in particular food security, to an extent food access, food culture, as part of our project, are things that go beyond just the neighborhood boundaries. And you're oftentimes working with organizations whose mission is not necessarily specific to the Vista neighborhood, or may include projects that are just outside the Vista neighborhood. So trying to figure out just how far beyond those neighborhood boundaries you go to trying to be true to the nature of the project and serving the Vista residents has been a challenge.
All right, so in order to sort of overcome these challenges we are facing, we sort of had to implement some unique strategies and data collection processes to ensure that we had an accurate representation of what the Vista neighborhood looks like. And I'll let Adam talk a little bit about the community engagement, since he was really the leader of that particular strategy.
Sure, and so the one advantage we did have with being a neighborhood-specific project is it makes it much easier to directly engage the community. And we've done this in a few different ways. One is through the Energize Our Neighborhood project, where they have formed, I believe, 7 or 8 different focus area groups. These groups meet on different bases, but the one that we met with, the Health and Community Services focus group, they meet almost monthly, and so that served as a good way of getting feedback, gathering support for the strategies in our neighborhood. The other thing that we've done is attended a couple of neighborhood events. One was a July 4th celebration. The other one was in conjunction with a neighborhood cleanup, and so that allowed us to interact directly with the residents and get their feedback on where they shop, some of the obstacles they may face in acquiring healthy, affordable food.
Another really unique strategy we used to get together neighborhood-level data was we partnered with Boise State University. One of our coalition members, Mark Seaman, offered his Nursing 411 class to help us gather and aggregate the data from a community survey that was launched both through Mark's class and also as an online component that I'll talk about in just a minute. But I wanted to focus on using the university as a means to collect neighborhood-level data. A lot of programs, graduate programs in particular, really want their students to get out to the communities and start working on projects. And we recommend for other coalitions who might be facing similar neighborhood-level data collection challenges to go see if there are any students who would be willing to help gather data, maybe to provide you with additional resources, additional capacity to really assess what the community has to offer in terms of health. We know that the students had a great time going out there talking to the community. Since it was a nursing class, it was really one of the first non-clinical experiences a lot of these students had. And so Mark reported back and said that the students gained a lot from this experience, and we were able to utilize a lot of the data they collected, things such as food cost analysis. The students went and looked at 6 grocery stores and provided us with data about the price and availability of food in our local markets, and that's really useful, and it's really helped us move forward. So that partnership was really unique, and also partnerships with the other city programs, such as Energize, such as the ULI. These are also really great to help us sort of get additional information that we didn't have otherwise. The corridor study that Diane Cushland from our coalition headed was really great at providing us with some of the transportation data that wasn't currently available for the neighborhood. So we were really able to utilize a bunch of community resources to get a good understanding of what the neighborhood looks like in sort of some non-traditional ways.
And this project has definitely benefited from the synergy with Energize Our Neighborhoods and the ULI project. Without those 2 projects, doing this Plan for Health would have been much more challenging. So this has, in some ways, served as a great model that could possibly be used by other communities in trying to build partnerships with other other projects that may be going on that can build on one another.
And sort of one last comment about strategies to overcome these challenges as we move forward here is I wanted to talk a little bit about the survey. We had to do a primary data source collection approach with this project. So we designed and distributed a survey to all the Vista neighborhood residents, and that was distributed through both the online survey, which was advertised through a mailer that was distributed through the city to all residents of the Vista neighborhood, and also through the student partnership. And this was a really valuable tool for us. It allowed us to collect data that otherwise wouldn't be collected. We were able to sort of come up with some really interesting information about things like food literacy and food culture that aren't collected through normal public health data assessments. So it's sort of just some really brief findings. We found that 18% of Vista residents indicated that they utilized a food pantry or similar service once in the last 3 months. And this is something that really helped us feel confident about our recommendations and our strategies, knowing that there are people who are experiencing food insecurity within the neighborhood. So these unique strategies really allowed us to go beyond some of the traditional assessment means moving forward. So sort of just to wrap everything up, we'll talk a little bit about sustainability of our coalition, just incorporating into the current programs. It's a communication tool for future efforts. And then our ideal outcome of this is to create a model for other neighborhoods to utilize, because we do think that planning at the neighborhood level is such an important part of food assessment. Planning for food security is very important. And by providing a model for assessment, maybe some of our survey questions or our partnership methods, we think that that's a great way to expand the benefits of this process moving forward, and not just the sustainability of our coalition, but the sustainability of this process moving forward.
I think that concludes our mini webinar. If you have any questions or would like to contact us, we can be reached by our email addresses, Aaron, AARON, @agnewbeck.com, AGNEWBECK.com, or at my email address, adam@agnewbeck.com.
Thanks for your time.
Thank you very much.